Okay, good. All right. Good evening, everyone. Thank you for joining today. We are here talking about glaucoma today, and not just about the information, disease itself, but also how patients who have glaucoma can live smarter with it, live more effectively with it. And we have been partnering with iHOPE, which is the Indian Health Outcomes Public Health and Economics Research Center. And this is part of the series we're doing with them. So we've done so far a couple of articles with them, and we've done a video conversation with Dr. Raja Narayanan on diabetic retinopathy, which you will find on our YouTube channel as well. And today we are here to talk with Dr. Sirisha Senthil and Vijay Venkatesh on glaucoma as well. So quick introduction to both PatientsEngage and iHOPE. PatientsEngage is an online platform which believes that informed patients lead to better decisions and better outcomes for patients. And so we believe that patients must make the effort to learn as much about the condition as possible, and they have a right to ask the healthcare system for better information as well. And they should really consider themselves as partners in managing their own health. Quick guidance to people who are watching. This does not replace a medical consultation. So while we do have a doctor who will answer your questions, but these will be generic responses and not specific to your own situation. The session is being recorded. So if you're logged into Zoom, you can post your questions on the Q&A. If you're on Facebook, YouTube, you can post your questions on the live feed and we will pick it up from here. And as always, you can write into us at editor@patientsengage.com, and you can follow us at any of our social media pages, be it Instagram, Facebook, LinkedIn, Twitter, and YouTube. So let me quickly introduce iHOPE. iHOPE is Indian Health Outcomes Public Health and Economics Research Center. It's an exciting, collaborative, and interdisciplinary research center that has been set up with a research grant from the Wellcome Trust DBT India Alliance through collaborations between the LV Prasad Eye Institute, Indian Institute of Management, Ahmedabad, and Indian Institute of Public Health, Hyderabad. The key focus of this center is big data analysis, health economics, clinical and public health research in eye health. You can also check out their website, ihope2020.org, for more information. So let's talk a little bit more about our two experts here today. We have with us Dr. Sirisha Senthil, who's the head of VST Center for Glaucoma Care at the LV Prasad Eye Institute. She specializes in refractory adult and pediatric glaucoma management, and her education has been across Arvind Eye Hospital. She's got an FRCS from Edinburgh and fellowship from LV Prasad Eye Institute. She's been an investigator for many studies, published many papers, and is a recipient of many national and international awards. So welcome, Dr. Sirisha, for joining us, and thank you for taking the time. We also have with us Vijay Venkatesh, who's glaucoma patient advocate. And there are very few people in this country who are actively advocating as a patient for glaucoma. She is one of the rare ones. She's also a region head for Max Foundation, and she's very active on social media. So, you would have seen her if you're active on any of the social media channels, be it Instagram, Twitter, and Facebook. Before we get started, let me ask you, Vijay, why do you share your experience? Why are you here to share your experience? Sorry, you're on mute.
Yeah. So first of all, thanks for having me here. It's really nice, and to be on the panel with Dr. Sirisha, who I've known for a few years. So why I like to share is I work with cancer patients, and I have seen how beneficial it is to offer a platform to patients and caregivers where they can come together and share their experiences, learn from each other. Any condition isolates the person, and with isolation comes fear. And I have always felt that talking about what is the issue that's causing that concern, it kind of always reduces the impact, the negative impact, and also, you know me, I'm not at all shy.
Vijay, we are losing you. I think there's issue with your network. I think we'll come back to you, Vijay. Dr. Sirisha, maybe we'll start with you first.
Be an exhibitionist, and then why not talk about my glaucoma? Oh dear.
Right. Yeah.
Is that better now? Yeah.
Yeah. Now it's better. Yeah. Sorry.
All right. Yeah.
So, yeah, I think you'll have to repeat that a little bit because we couldn't understand what you were saying.
Okay, that's for me, right? Is it better?
Yes,
now?
that's for you, Vijay. Yeah.
Yes. So
I think, okay, we're still having a problem with your network, Vijay. Okay.
I just told you about how important to share. Oh my goodness. Oh, I'm really sorry. Let me see what I can do to make it better. Yeah.
Yeah. Okay. All right. Dr. Sirisha, let's come to you in the meantime. If you can let the audience, I mean, obviously people who have glaucoma know what is glaucoma, but there may be a few who are watching who don't have glaucoma. So if you can start by explaining to people what is glaucoma.
Yeah, thank you so much for having me here. I think it's very important for us to speak about this disease. Many people don't understand what glaucoma is, and what is worrisome is that even if there is somebody with glaucoma in the family, the others don't seem to be worried about it. It's like, it's like an accident. Everybody feels that they won't get it, or they will not get into it. Glaucoma is a condition where there is damage to the optic nerve, the nerve that connects the eye to the brain, which is most important part that carries the impulses from the eye to the brain. So in glaucoma, there are no symptoms. People slowly start losing vision because of elevated intraocular pressure, and that leads to permanent vision loss or blindness.
Right.
So this condition is dangerous in two ways. One is rarely come to you saying that they have a problem. And if they come to us with a problem, which means that they've already lost more than 90% of their vision.
Right.
So the only way, and this condition causes irreversible blindness, meaning like once they lose vision forever, and there is nothing that we can do to revert it back. So the only way we can actually prevent people from going blind because of glaucoma is to be aware and have an early diagnosis. So early diagnosis is only possible if they reach the doctor, and by a series of tests that we do, we will be able to pick up the disease, and it can be easily treated if picked up early. And
right.
for the rest of their life, the vision can be very well preserved. The only issue is with the late diagnosis, which is seen in more than 90% of the patients in our country. So it's a huge burden. In the West, usually about, let's say, undiagnosed glaucoma is about 50% in the population. Whereas in our country, in both the surveys that were done in LV Prasad Eye Institute as well as in Chennai Glaucoma Study, both of these large population-based studies have shown that more than 90% of the patients with glaucoma are not aware of the condition.
Right. So, because you said it doesn't have symptoms, how is somebody supposed to figure out that they need to get tested for glaucoma?
Yeah. So I think that's a very important question. What we need to do is like most degenerative diseases or lifestyle diseases, what we need to understand is beyond the age of 40 is a risk for whether it is diabetes, whether it is hypertension or whatever. So I generally tell people that beyond the age of 40 years, each of us requires a reading glass. So which means we do get presbyopic and we require a reading glass, for which we definitely need to see either an optician or an ophthalmologist. That's
Right.
an opportunity for us to start evaluating for glaucoma as well. So once in 2 years, anyway, you go for a change in the glass. So just do that additional proper testing, comprehensive testing of the eye, which includes evaluation of intraocular pressure, evaluation of the optic nerve. And if there is glaucoma, we can very easily pick it up. So instead of just going to an optical shop, buying a pair of glasses, not having an evaluation done is not appropriate. So I think that's the easiest way to pick it up.
Right. So just to clarify then, the optician can do the evaluation or they will need to go to an ophthalmologist?
So most of the opticians, in fact, they do have optometrists who are available in the clinic. But I think what the major problem I understand is that people don't have time. You know, you just go wear a pair of spectacles, and if you're able to read well, you just buy it and come away. And eye evaluation requires at least 1 hour or 2 hours time, where you do the checkup of the front of the eye before dilatation. And after dilatation, we need to take a look at the back of the eye. So without dilatation, when we do a checkup, we only do a 30% checkup of the eye. Okay. Only when we dilate, we can take a look at the optic nerve or the back of the eye, which means that glaucoma can easily be missed if you don't have a dilated examination. Right. So we need to be prepared to spend that 1 or 2 hours for ourselves once in 2 years, which is not a big thing actually.
And you suggest that for everybody, not just those with a family history.
Correct. You're right. So those with family history will definitely need to be tested. And for some certain type of glaucomas, in fact, I tell them even earlier than that. Not 40 is an arbitrary number that we have. And I always tend to correlate it with the need for a presbyopic glass, and hence it becomes easy for them. That apart, beyond the age of 30, 35 years, especially if they have a condition called angle closure glaucoma, which can occur much younger in Asian population.
Right.
Yeah.
Right. Okay. Vijay, we're seeing two of you now because you have you're cut out at the back.
Oh my goodness, yeah. So
but if you can talk about, because I think given that Dr. Sirisha just talked about the family history, etc., if you can talk about your own case where you did have a family history, and did that make you more vigilant, and how did you go about kind of getting a diagnosis?
I'm really ashamed of this because my mother was diagnosed with glaucoma. She was staying with me those days, so I was the one who took her to the doctor, organized her checkup, and then everything. But even though I worked in healthcare, I kind of never ever made the effort to have myself checked or encourage my siblings. And that is really unforgivable. Because it's just not about not having time. It's about just not being aware and not taking one's health seriously. Till today, that is a big regret, because if I had done that immediately, then maybe I would not have lost the vision that I have lost. So for me, what happened was, no, I did not make any attempt to do a periodic checkup. I kind of went about with my work, and very gradually I was losing vision, and I didn't realize till a lot of it had gone. And what really alerted me was this feeling that, hey, you know what? I'm kind of behaving like my mom. I'm like putting the glass down with a bang. I'm tripping. I'm walking into glass doors and stuff like that. And by the time I went to the doctor, now I was like 58 years old. This is about 12 years ago. And that's kind of young to start with glaucoma. And so the doctor I saw was extremely upset with me. And, he said, this is ridiculous. And well, yeah, I just had to sit there and listen to him, as to how careless I'd been, which is why you asked me earlier, why I talk about my glaucoma, which is why I tell everybody that, what, this is it. You just, whether you have family history or not, above the age of 40, you need to get your eyes checked. And I think a lot of us in this part of the world, we the only eye doctor we go to is the guy who sits in the optician's shop and checks your vision, and that is not enough. And we just heard Dr. Shirisa say how important it is, how much time they set aside to examine a patient, as the patient has to be examined.
Right, right. Um, so, Dr. Sirisha, coming back to you, I mean, obviously, family history is a risk factor, but are there other risk factors which increase your chances of glaucoma?
Yeah, so the other common problems that can actually increase the risk of glaucoma is possibly having high myopia. So short-sightedness or high myopia is a condition which is very closely linked to glaucoma. They can have a higher risk of developing a condition called open-angle glaucoma. The other things is trauma. So anybody with a previous history of trauma, has had any intraocular surgery when they were younger, all these are risk factors as well. In our country, what I think which is very close to my heart is use of indiscriminate use of steroid drops or ointments on the face, which is a very big problem in our country. In fact, across the country, both here in the south as well as in the north, if you look at the commonest type of secondary glaucoma in children, it is steroid-induced glaucoma. And we have published in the British Journal of Ophthalmology, where we have shown more than 50% of these children, when we diagnose them, were blind at least in one eye.
Wow. And they are all steroid induced.
Imagine the impact. They're all steroid induced, be it steroid drops that they're using for the allergy, which is very common in our tropical country, or they use these skin ointments because of some black spots, or fairness creams for that matter. Majority of the fairness creams also have steroid, and unfortunately, several of them don't even mention that this is the content in that. Wow. So many, and the worst thing is that if they have been using it even for a month or two, they can develop this problem, not necessarily over many years. So that's the disturbing thing. The impact of this problem on the child, on the family, on the general society is huge. Correct. So for me, it is a very big thing. Through the Indian Pediatric Glaucoma Society, which we are a part of, we are very much wanting to take this towards to the government, because what is happening is that in our country, even smaller countries, I would say, which are not even developed as much as India, steroids are not available over the counter. You need to have a doctor's prescription, and a refill requires a prescription as well. In our country, anybody can just go and buy anything that they want for as long as they want. And unfortunately, these are the most cheapest medications available. 8 rupees, you can get a bottle of steroid. Okay, so it's cheaper, it gives you quick relief, and it's available. So, I think these are bad combination, or make them so expensive that they cannot afford to buy. Something has to be done about it.
Right. I'll come to you, Vijay, in a second. But talking of steroids, because we handle and we have people who have, autoimmune conditions, etc., and often steroids is the first line of treatment for them. So would that make them at higher risk of glaucoma? Should they get themselves tested as soon as they start on steroids, or it's about the dosage of steroids that matter?
Yeah, I think that's a very important question. So systemic steroids. So steroids as such are not bad. I think let's clarify that point first. Correct. Steroids are not bad. And with COVID, majority of people know that that was the only drug that could save several people from losing their lives. So steroids are not bad. When indicated, used appropriately by your treating physician, it's fine. But somebody has to keep monitoring it. Be it hypertension, be it diabetes, be it any of these conditions can be caused by long-term use of steroids. Correct. Systemic steroids per se have very minimal effect on the intraocular pressure. They can cause cataracts, but it's not that they do not cause glaucoma, but the tendency for people to develop glaucoma or the side effect is far less compared to the drops that they use and the skin ointments that they use. And majority of the skin ointments are used in and around the eyes or on the skin. And people, even if they have an eczema kind of a problem and they use the ointment on the leg, it can through blood circulation affect the eye as well. So the topical applications are far more dangerous compared to the oral medications.
Okay, thank you. Thank you, Dr. Srisha. Vijay, you wanted to add something there?
Yes, because both my mother and I had skin conditions and we used Betnovate C, I mean, like all the time. And we were told that that is really one of the major causes of glaucoma. So I just wanted to mention that when doctor was talking about steroids and indiscriminate use, we were prescribed Betnovate and, you know.
Right.
So both of us, yeah.
So I guess the point then is if you are prescribed this for whatever reason, then you need to proactively test for glaucoma as well.
Yeah. One is do not use it beyond the time that is prescribed to you. And many times, you know, patient tells us that every time I go, the doctor prescribes the same thing. So I thought, why to go? Might as well continue it. But that's not right. And number two, even some specialists for that matter, let's say medications used for asthma. Somebody is breathless and they continue to use the steroid inhalers. I know of people who tell that steroid inhalers have such minimal quantity of steroid that it's not going to cause glaucoma. But I can give it to you in writing that I have so many patients who have glaucoma or on inhalational steroids, their glaucoma just goes uncontrolled. All you need to do is stop that and ask them to take an alternative medication. Pressures come down. Then how do you prove that? So the best proof is the fact that it reverses when they stop the medication, right? So it is important, but for somebody, it may not happen to everyone, but somebody who's predisposed and who is have a tendency to develop a problem or has a problem are more responsive. There's a term called steroid responsiveness. That means in the general public, if you see, not everybody who takes steroids develop a high intraocular pressure, but there are certain percentage of patients, which I think is about 18 to 20% of the people, can be steroid responders who can be low, moderate, or severe steroid responders. Right. So that's the thing. Yeah.
Okay. And once you are diagnosed with glaucoma, what are the treatment options?
Yeah, so once the glaucoma is diagnosed, treatment is quite simple. It again depends upon the type of glaucoma one has. There are two basic types of glaucoma, especially the primary glaucoma. So when you see primary, when I say primary, primary has no secondary cause. It's very simple. The word is self-explanatory. Secondary is secondary to a steroid use, secondary to trauma, secondary to surgery. There is some other cause that is causing glaucoma. Whereas primary, there is no cause. There is no external cause that is causing this, but per se, they may be genetically predisposed and the drainage channels inside their eyes are not functioning as well as they should, which is mostly, again, hereditary type, if you want to look at it that way. So there are the open angle and angle closure glaucoma. For angle closure, they're definitely required to have a laser to create a fluid circulation pathway, followed by medical treatment. And for open angle glaucoma, majority of them are treated medically. When I say medically, they are in the form of eye drops. Treatment is quite simple in the form of eye drops. And once started on treatment, the treatment is lifelong and they need to continue it for the rest of their life unless they have been operated for glaucoma and the pressures are well controlled.
Right, right. So just for those who've joined in late, we are talking to Dr. Sirisha Senthil and Vijay Venkatesh on living smartly with glaucoma. Vijay, you talked of some of the early signs and you realized that, you were tripping more, you were banging into things. Were there any other signs, and also how does it affect activities of daily living?
There is loss of peripheral loss of vision, and there is you lose depth perception because you only, for me, just one, practically it's only one eye that has vision, and bright lights hurt a lot. And objects, you cannot gauge the distance. The first thing I had to do was stop driving and stop riding a bicycle. And because the doctor told me that, you are not safe out there, not only your safety, but also the others. And the first thought that came to me, I don't know if this is going to, this is an answer to your question or not. So many people who drive taxis and auto rickshaws and buses and trucks, and I wonder, if they have glaucoma, and if they have, do they have access to the kind of screening we're talking about? And here, like the doctor said, can they ever find the time to do what they do? Because definitely mobility and being able to drive a vehicle is greatly impacted by the loss of vision. And for me, what happened was, yes, I used to trip and fall because I couldn't see the level of the ground. I mean, I had lost that kind of the vision, and if I have to look down and walk, then I would hit my head against something which was on top. And if I would look straight, then I wouldn't know how how erratic everything was at floor level. And then, of course, putting things down on a table, I became so clumsy. I would put a glass down and it would just fall somewhere else. It wouldn't sit on the table. And I almost got run over by a car because I couldn't see it coming with that from the side where the damaged eye was. And so these were alerts. But then, how we kind of tend to say, oh, this was because of bad lighting, or this was because of I wasn't looking where I was going. And then I realized I literally wasn't able to look where I was going, which is why this was happening, And all the things that doctor said, I had to go through. First, it was laser and then drops. And then you have to be very, very compliant with your eye drops, which I was not. And that kind of aggravated my condition. So I had to have more than 2 surgeries. And now after all my surgery, my pressure is under control. So now I have no more medication, not even drops. And after like 8 years of treatment, I know that it's not deteriorating. What's gone is gone. But so I still have all these problems. I still have to look where I'm going very specifically. Before I put down a glass or I reach out for something, I have to make sure that I'm doing it the right way, and glass, and then always protect my eyes with dark glasses. And which is why I really feel that the more people talk about glaucoma, the more people are going to be saved from this misery.
Right. So, Dr. Sirisha, obviously, in the case of Viji, I think the diagnosis ended up being quite late. But if you do catch it early, just medication alone keeps it under control for, a long time. What's your advice, or what is your message?
Yeah. So I would say close to about 80 to 85%. It's just from our experience that we can say disease. But a certain group of patients for medications do work for a certain time, beyond which they may not work, or the disease continues to progress, and hence surgery would be required. So there are multiple types of surgeries available. Earlier days, it's like one surgery works for maybe a few years, and after that, a second one, then they don't know what else to do. But with the advances that we have today, I would say that there is a particular eye on which I must have operated about 8 or 9 times. It's not like you want to do it, but if the pressures are not under control, you wouldn't let go, right? Because in front of your eyes that person is going to go blind, and you don't want that to happen. So you would do all that you can to make sure that it is halted, and we want to prevent it. So there are multiple options available to treat it. The commonest being medications, but like Vijay said, you have to be very, very compliant. It's like, so patients always say that, doctor, I'm coming to see you. They won't use the miss. So I didn't use the medication this morning because I wanted to check how the pressures are without the medications. So I tell them the fact that you can give a medication is because it doesn't control otherwise. And so there's no experimenting after that. And I specifically tell them, if you're going to come to my clinic, please use the medication that morning. Otherwise, your trip is wasted. And I will have to call you back again a week later or 10 days later, which means both of us are going to waste our time. So please use your medications regularly. No stopping this, no experimenting it. Despite which, if your pressures don't control, we may need to keep adding medication. So, that's very difficult. Many times they ask us, doctor, for now I'll use. After some time, I think you should try and reduce them. I said, I'll be happy to do so. if your eye does not require it. But yes, sometimes what we do is with the new medications that are coming in, we do have medications that are available. Somebody for 3 drops. It's possible that we may combine 2 medications into a single bottle, and so the number of applications can come down. Definitely, that can improve their quality of life, and they don't have to be worried about keeping an alarm and waiting until they put the drop before they go out and things like that. So
Right.
yeah, we can definitely help to improve it. But the bottom line is medications do work, but they have to be used very, very rigorously on time as prescribed by the doctor.
Right. We've got a question on medication. Do medications cause darkening of skin around the eye?
Yeah, so there are lots of medications that are available, and each one has a certain side effect. The one particular group of medications called prostaglandin analogs are the commonest used, and they are the most effective. And in fair-skinned people, they can cause very yeah, so but I'm sure if that is a concern to you, you should speak to your doctor. There are ways to try and reduce it or try to replace it with a medication that doesn't cause so much of a problem and things like that.
Right.
So I would like to tell them that medication is a medication. No tablet is going to taste sweet, right? Tablets are kadua, whether we like it or not, we take it and you just swallow it. That way, when you put the drop, whether it stings or causes some redness, it is going to be there for a short time. But you think about the good effect that it has, that it can save your vision and prevent your eye from going blind. And once you have that in your mind, I think these side effects will really not matter.
Correct.
But like,
I think some medications give you nice eyelashes also, right?
I know. There are people who actually pay 3 times more cost for the same drop to be applied as whatever
enhancers or something. Right.
Yeah.
Okay. So coming back to Vijay and even you, doctor. Obviously, if your eyesight has got affected, then it affects, as Vijay explained, various activities, and it increases your tendencies of falls and accidents, etc. So are there any kind of tips, Vijay, that you can share with people as to how to reduce those incidents of falls, just in terms of managing day-to-day activities? And like you said, you stopped driving. What else were some of the things you've done? How do you navigate steps, for instance?
See, I speak from a very privileged space, so wear proper footwear. That's the first thing. Wear footwear which doesn't have heels, which has straps, so you can buckle, or wear good shoes when you walk. That is, of course, which is very, very important. And believe me, it is only when you become handicapped, you realize that there is absolutely, how handicap unfriendly our country and the spaces in our cities and everywhere are. Look at the roads, look at the sidewalks, look at the absolutely unnecessary bright lights and these granite floors and no railing anywhere, no specifications, like the steps can be of any height, can be of any depth. So it is so easy for someone who doesn't have 100% vision to have accidents. So walk slow, give enough time to yourself. So now when I travel, because my work is a lot of travel and it's a lot of walking, visiting different hospitals, going to different cities, towns. So I take my time. I'm very slow, very careful. You can never be in a hurry, should never be a person in a hurry when you have glaucoma. So that's something which I learned the hard way also. And if I'm not careful, I know I'll trip and fall anytime. So that's very, very important. And I also think that somewhere, like what doctor was saying about how we should advocate for controls on sales of steroids. If we can somehow do something and see that we put up railings, we put up handrails, we make our public transport more helpful to patients. You look at the buses and there's raised so high. It is so difficult to clamber on to a bus, or even the airport buses, and You look at some of the auto rickshaws, you look at some of everything. So it's only when you're handicapped you realize, that everything is a struggle, but you have to surmount it. So you have to be careful. I've become very slow. I don't rush. And I visit my doctor very regularly, get my perimetry done. And I mean, I have to go and see my doctor every 3 months, and I make sure that I don't miss that, because I know that as I grow older, I know that there's going to be very gradual, very, very gradual deterioration, because, that's bound to be there. So it's better to be aware and make sure that you see your doctor as regularly as he wants you to see you.
Right. Yeah, so I think some of the disability groups have been advocating for lower, buses with lower, lesser height and so on, but it's still a huge challenge. Dr. Srisha, I would like to add anything to what Vijay said.
Yeah, I think you summarized it very well, Vijay. I think it's so important for people to realize. In fact, there was a gentleman today to see me who's a big person in the society, has difficulty when going out for a social gathering, that I always worry whether I'll trip and fall, because most of these places, especially let's say restaurants or places of gathering, don't have good lighting.
Yeah.
It's supposed to be what do you say, the in thing to have candles, and which is nice, but for people with problems they have difficulty. So he says, I actually put one foot forward, try and see if the depth is okay, check it, and then move on. And I get embarrassed, and it's very difficult for me, but that's how life is. So I told him, I don't think there's anything to be ashamed about. We are what we are, and we have what we have. So switch on the light that is there on your phone. Most phones have that. So try and brighten up when you're walking and the path that you're going in, so that nothing can give you more, and that is always there with you. So try and illuminate places. When they require more light while reading. So the regular illumination is not sufficient. So I tell them that if we can't change your eye, change the environment. That change the environment depends on how you illuminate the places that you move around. Don't try and I tell the family members that don't try and change the furniture and their the way you lay them at home very often, because they have difficulty in understanding and navigating. The reason why they're so comfortable at home is because they know what is where. Even with minimal vision, they don't have accidents. They manage to do things. And elderly people, if they have a fall, it's the beginning of the end. So you definitely don't want them to have such problems.
Correct. So one question that's come in, is there a particular time when the intraocular pressures are at its highest?
Yeah, so that varies from time to time, and most often early morning is when the pressures are usually at the peak. That's when your body, the hormonal changes in your body and the metabolism. So depending on so many factors that are there, early morning rise in blood pressure, early morning rise in intraocular pressure is something that's well known.
Right.
Yeah.
Right. Okay. So coming back to our next question, the question that always gets asked in, for most patients is there any changes in diet that can help? Does diet play a role?
Not really, but what I would like to say is that water drinking is one very important factor, and I think that's something that all of us see people do. Let's say 2 liters of water, 3 liters of water to be taken empty stomach in the morning. Drinking water is good, is very good for your health, but excess water intake at a time is not good. Whatever it is, water, when I say liquid intake, whether it is water, whether it is alcohol, whether it is whatever that they take in the form of a liquid excessively at a time, that's not good, because you're overloading your system, and the pressures can suddenly shoot up. In fact, I have a few patients whose pressures are so well controlled, and once in a while when they come, the pressures are absolutely not controlled, and I break my head and I sit with them for a couple of minutes to find out what was different this time. And so a gentleman, I think 6 months later or 8 months later, when this happened 2-3 times in a row, he then confessed and said, yes, doctor, yesterday I was out at a party, and can that affect? I said, yes, if you have excessive intake of liquids, fluids, whichever way you take it, can have increase in intraocular pressure. So
Right.
I think you need to stage it and try and take it in lesser quantities, which is fine. Drinking 5 liters of water is fine in a day if that is something that helps you, but try not to take it at a time. So that's one thing. Exercise is again a common question that's being asked. Is
Before you go
exercise
to exercise, I have a question on the water as well. So, a lot of people do take half a liter to a liter of water in the morning, right? Is that okay or it's not okay?
No, half a liter is, so I would say 2 glasses of water are fine. But
Okay.
anything more than that, try give it, because you I don't think we can take more than that and not necessary. So give a gap, maybe half an hour or so, and take another 2 glasses, because your body also needs to flush it out, right?
Right. Right. Okay. Yeah, sorry, you were talking about exercise. Yeah, go ahead.
Yeah, exercise is another thing that people commonly ask. So exercise is good for your health. Go ahead and do it. There are some studies that have shown that yoga actually helps to decrease intraocular pressure. So I think it's something to do with your mind, meditation, and calmness, which decreases the adrenaline levels in your body, which again have an indirect effect on the intraocular pressure. We need to understand that everything is, so whatever you do, there is a certain reason why it works. So people have shown, in fact, in AIMS RP Center, there are a couple of our colleagues who have shown effect of yoga and meditation on decreasing the intraocular pressure. But the caveat here is that you cannot just do that and skip your medications. Continue to take your medications that should be treated medically, but that apart, all these things can help. So
Right.
contrary to that, being anxious, being worried all the time, that increases your adrenaline, increases your cortisol levels, and that can increase the pressures as well. Yeah.
So in terms of exercise, one question that we've got asked before when we announced this also is the use of weights. Is there a problem people are doing weightlifting?
Yeah. So I would say that excessive weightlifting is not a good thing. Unless you're training to be a bodybuilder and things like that, they're different. But I think we need to be careful, especially for me following surgery, and I'm very, very particular. If I operate a patient for half an hour, the next day I take that much time to explain to them the don'ts, because I think it's very, very important. So especially when they've had a surgery for glaucoma, what we do is we create a bypass for the fluid to drain, which means a part of the wall of the eye is also weakened. In
Right.
situations like that, doing excessive weightlifting and excessive pressures for that matter, meaning like the straining while stools or excessive cough or anything that increases the abdominal or thoracic pressure is also not good.
Right.
But that
Right.
part, I think lifting heavy weight alone may not cause glaucoma.
Right. Right. Vijay, any experience from your side in terms of, have you seen any impact of exercise or diet? Any experience from your end?
Yeah, and nothing as far as diet is concerned, but I did hear that type A personality is very susceptible to glaucoma. And when you're which I'm deaf, like I'm loud, I'm vocal, I'm like very energetic, and I get very hyper, as that's a popular term to use. And I've seen my mom's also like that. My mother had glaucoma when she was 60, and she's 95 now, and she also has lost vision in one eye. But I have learned a lot from her, how to be calm and how to continue to do everything. My surgeon also says, that please try and be as normal as possible. And but then, yes, I used to do this Kapal Bharti, which then somebody told me that is harmful, because that puts a lot of pressure. I don't know what doctor would like to say about that. I used to do that very regularly, and I found it really kept me very fit. But then I was told that could be one of the cause of why my pressure increased a lot. So otherwise, now my life is as normal as can be. I read. I still work. So all my work is on various screens. My my laptop, my iPad, my phone, my desktop, and I read on my Kindle, I read paper books, and I try and not stop anything. Only when moving, I'm really, really careful, and I make sure that there's good lighting when I read. And otherwise, yeah, I've had it for 12 years now, and I'm going to be 70 in a couple of months, and I can only hope that the way my mom has managed her glaucoma, and she would knit, she knits, she reads. I mean, she watches TV, but yeah, I guess just being careful and not tripping and falling is the most important thing.
Yeah. Right. I don't know, Dr. Sirisha, if you heard the question on Kapalbharti. Right.
It's running out of chat, so I tried to come to close to PowerPoint.
No problem.
So yeah, I agree with you. So that's why I said anything that increases the abdominal and intra-abdominal, intrathoracic pressure, that also increases the eye pressure. So that's something that we should try and avoid. Okay. Anything else, actually, you don't need to do so.
Right, right. Are there any complications of glaucoma that people who have glaucoma should be aware of?
So if the pressures go uncontrolled, they also can have, just like a stroke, they also can have a vein occlusion or a stroke in the eye, and that can cause sudden loss of vision. That's one major thing. That apart, like, let's say majority of the elderly people also have cataract. When they go for a cataract surgery, they may have glaucoma, and then, after surgery, people realize that the vision is not improving, but you actually could be having another additional problem, which is likely to be missed.
Right.
So these are things that people should be aware of. But as such, glaucoma per se causes loss of vision. But I'm talking about glaucoma causing a retinal condition, glaucoma patients likely to have cataract a little earlier, and things like that.
Right. And again, what can patients do to prevent these complications?
Have the pressures under control.
Right. Okay. I think I'll just do a quick check. I don't think we have any more questions from the audience. Yeah, I think there's nothing else. Okay, so okay, I guess one question. If early morning time is the highest pressure, what is the best time for the drops?
Yeah, so that's an important question, but I think there's no best time for the drop, one best time for the drop. So some medications are given at night because they work, let's say, the peak effect of the drop is about 4 to 5 hours after they apply the drop. So if that is the case, early morning pressure rise is there, then I prefer to give the drop in the previous night. Some medications we give it at night because they have side effect of redness and things like that. You don't want that in the morning hours. Some medications are given in the morning and not at night, because some medications don't work when your baseline blood pressures are on the lower side, which means at night they don't work very well. So if a doctor is prescribing a medication at a certain time point, that means the mechanism of action or the peak effect of the drug has to fit into the way the patient's requirement as well. So it's not just about the peak pressure.
Right.
I think you leave that to your doctor. They'll take care of it.
So I guess the point is that you should have the conversation with your doctor on the issues you're facing, and then figure out with them as to what is the protocol that works for you. Okay. Anything else? Final words, Dr. Sirish? Yes, Vijay.
Yeah, I want to ask also Dr. Shirisha. I have felt this, the other patients who see my surgeon, some other people I know who have glaucoma. Why are glaucoma patients hesitant to come out and say that they have glaucoma? I've struggled to put a support group together. It's just not happening, and sometimes I find I'm the only person in my social circles who's actually talking about glaucoma. So I'm wondering, is there nobody around who has glaucoma other than me and my mom?
That's a good question that you asked. So I think it's the social stigma that is attached to it. I don't know why people have to really feel bad or sad
Right.
about wearing it, but we do have a few celebrities who do, including you, who tell us that I have a problem, but I'm okay with it, and you can live with it, and you show them that if you treat them well, get it treated well, and if you are compliant with your medications, we can continue to see for the rest of our life. So I
Yes.
think the social stigma involves not just glaucoma, but I think any medical condition for that matter.
Very true.
A couple of them, come and close the door and say, doctor, you know what, even my wife does not know it, even my mom does not know it. So even to their family members, they don't want to reveal, as if it's
Yeah.
a contagious disease. It is not. Please,
Yeah.
please understand that it's a condition that can affect you and me, anybody. You have
Right.
it, then we have to be aware of it and try and tell people that, see, these are the problems. So the same thing that I was talking about, the celebrity that you say is, dim light, I have a problem with the dim light, and I think I would prefer if the light is brighter. There's nothing wrong in asking that.
Yeah.
Right.
So,
Correct.
yeah,
Absolutely.
I think we need to understand that people are not going to underestimate us, or have a different view of us if they know that we have a problem. That's okay. I think we need to. I don't know how to answer that question, Vijay, but I guess we have to become a little bit. In the West, the patient awareness groups and glaucoma groups are very, very active. But here, like you said, we are struggling as well. We do that. There's a small group, but it's not as active as the cancer groups that you people. I keep asking Sendil this question. So, how is it that cancer is even more a difficult term people associate with, but they have such fantastic patient support groups? But for
Yeah.
glaucoma, nothing. In fact, there
Yeah.
are certain countries where the glaucoma patient support groups actually give money for the research. Can you believe it? They fund the research. That much of a money they have, and that's much of a strong hold they have. While in our country, it's very, very difficult.
Yeah.
Yeah. So
I
I
think
think we are in the early stages of
yeah,
patient advocacy in our
yeah,
country. And I also wonder, and this is just a question to both of you, I also wonder whether with cancer, it's now seen as a big thing, and therefore it's okay to be part of a support group. With a lot of other conditions, there is this feeling that, do you really need to be part of a support group if it's not overwhelming you, right? So there is a little bit of that, and often the family members question them. They themselves are not sure what they get out of it, etc. So I think there's still, I think most Indian patients and family caregivers struggle to, in their mind, define the role of a support group really. So that's our experience talking to various, patients across different conditions.
Yeah. Even now, going to see a counselor, going to see a therapist, it is not the easiest thing for somebody, in our region, in our socioeconomic,
Yeah,
yeah, to do that.
right.
And somehow I feel that, the glaucoma patients I have met, somehow feel that this condition diminishes them in the other person's eyes. That's such a pertinent thing to say, because we're talking of laws of vision, but they kind of feel that it diminishes them in the other person's eye. Like kuch kami hai. There is something, something wrong with me. And I also feel somehow that they are not willing to really look at it as something that will deteriorate, and it's something that they just want to kind of not look at. That's it, just not
Right.
look at.
Right.
We did do a couple of support group meetings, in which I did some drama therapy together with my surgeon and his wife, and then we called them all again, and then they were like, no, it's fine, we're okay where we are, kind of, yeah.
Right. Right. One question that's come in is, uh, I have high myopia and hypertension, so I don't know if she's diagnosed with glaucoma as yet, but she says, can we do brisk walking and little running?
yeah,
She's 56.
can.
Yes, you can. So, yeah. Okay. All right. So any final words, Dr. Sirisha?
Yeah, thanks so much for putting this together, and thanks, Vijay, for sharing your experience. And I think it's very, very important, and we need to have more such informal groups, engagements to make people aware of such a condition where early treatment can definitely be given and blindness can be prevented, and to especially for the high risk people to have a regular checkup done and make sure that at least your own family members don't go blind.
Right.
So be aware and prevent blindness from glaucoma. That's all I can say.
Right.
Yeah.
Thank you. Thank you, Vijay, once again for coming forward and sharing your experience. And, thank you, Dr. Sirisha. I would want to reiterate that if you are not yet diagnosed with glaucoma, please get tested, especially if you're above 40. And if you are on steroids or if you tend to take steroids, please again be vigilant and get, checkups done, because that's something that I think it's not something that people are very well aware of. And thank you once again to iHOPE for partnering for this series on awareness. And if anybody is watching and has a suggestion on a topic for eye health, please drop in a message to us. We will pick that up as we go through our various sessions on eye health. Thank you, Dr. Sirisha, once again, and thank you, Vijay.
Thank you. Bye-bye.